We've all been dealing with COVID-19 for about 8 months now, and it seems that very few people truly understand what's going on when this virus infects people or how to treat them. As a result, there's hundreds of thousands of people that are dead around the world. In an effort to better explain this, I want to put this into an analogy that I think will be easier to understand. COVID-19 is like a match. The red part, the sulfur part, is your immune system. Your immune system is a defense mechanism for your body designed to rid you of bacteria and viruses that infect your body. But it's also designed to help deal with other problems, primarily the result of dietary and lifestyle factors that result in coronary artery disease, obesity, high blood pressure, cancer, diabetes, stroke, a variety of commonly acquired problems due to poor dietary and lifestyle practices. Now, presuming that your immune system is not too immature or underdeveloped, like in younger people and children or people with immune deficiency syndromes, and presuming that it's not overly activated, as it is in people that are merely older because of all these health problems, including high blood pressure, diabetes, coronary artery disease, the list that we've talked about. If the immune system is not too underactive and not too overactive, but in balance, what will happen is it will simply put out the infection and go on providing you a healthy lifestyle. COVID-19 is much like a match. The wooden part being COVID-19, and the red part, the tip, is your immune system. When the virus comes into your body, the match is lit, and the immune system burns out the match, destroying it. But if your immune system isn't well developed, or if it's overactive from any of these other health problems that have been going on, then what happens is what's called an inflammothrombotic series of reactions. The inflammation, the swelling, the increased accumulation of blood flow and white blood cells to deal with the infection and to deal with all the inflammation going on in the body, and the resulting blood clots that occur once that's activated, is the equivalent then of the virus coming into your body, your innate immune system activating, and then dropping the match on gasoline. The end result is a fire. When we have a fire, the fire department is called in to help put it out. And if the fire department is manned by individuals who have been trained in how to put out fires and how to treat what type of fire, because not all fires can be put out the same way, then they will come in and successfully put out the fire. But if they don't know how to treat it, if they don't know what to do, then simply calling the fire department won't put out the fire. And that's what's been going on today. 90+% of the people dying with COVID-19 are dying because of these other health problems being made worse because of the inflammation already going on in their body. And the resulting inflammation and blood clots are killing them. This is an example where this information has already been known for a quarter of a century. I presented the inflammation and heart disease theory, which included an explanation of viruses, in 1995 at American Heart Association meetings. It was published in a cardiology textbook in 1999, and we went so far as to talk about some of it on 2020 in 2004. It's not that the information isn't available and shouldn't already be known. It simply hasn't been applied. And more critical is the information regarding the ability to measure this inflammation, this change in tissue, the metabolism and the regional blood flow associated with heart disease and cancer and COVID-19. The information's been made available. For ignorance and arrogance sake, this information hasn't been applied. It hasn't been listened to. And the consequence are hundreds of thousands of dead people around the world.